across Better Lives Foundation through you, I was just blown away by how much Devi and Raj, the founders, have been able to achieve with the team, with the amazing volunteers they've been going for many years now.
Yeah.
And the whole point of this is to establish and improve healthcare for the people of Yonibana, which is a small town in Sierra Leone, isn't it? About, 2 or 3 hours from the capital, Freetown. Yeah. So I decided that I needed to go because, one of our dreams together was to do health camps and volunteer in other countries. And we've been to India, we've been to Prashanti, we've been helping out there. But I think the fact that there's almost a long-term vision for Better Lives Foundation in terms of establishing a sustainable dental hospital, to provide treatments for the people there. I think that's one of the things that made me think, maybe this is the place we do need to go. So I still remember how we found out, was it just a few weeks before we were going to go, that we didn't have enough equipment there.
Yeah.
Because I've been waiting on these forceps to arrive. And it's going to help treat so many people. But when you're just waiting for things to arrive at the last minute, and it's like make or break. It was one of those situations. So yes, I'm very happy.
Good. So we're ready?
We're ready.
Where are we going now?
So now we're off to our warehouse in Slough, where we're going to do all our packing for our dental trip, as you know, to Yonibana in Sierra Leone. Got to get the whole inventory down and just get all organised for our trip as we fly off on Thursday. So really excited.
Cool.
That's right. I mean, one of the beauties, I guess, when you go to any of these kind of medical dental camps, you have to think outside the box.
Mm-hmm.
Resources are always hard to come by. So, it's a military operation almost, isn't it? You really have to plan so that you can execute really well there. So, when we found out how little we had, I'm glad to say I don't think we panicked. We were like, right, we've got to get some solutions in place. And we outreach to some fantastic colleagues that we know and charities that we know who do very similar work to what we do. And it's wonderful when you have a network.
Really good messages back and really amazing help for us. To Wilton House Dental Practice, to Keval and Sheena, to your practice, the Bupa Dental Care in Leighton Buzzard. Fantastic.
Yeah, I'm so grateful to them. I still remember the last piece of gauze that we used for the last patient. It was just enough, and that's when you realise that there's something out there, someone. I believe in divine intervention thing, and I was just amazed. A big shout out to Dentaid, who do a lot of work in places like Uganda, Malawi, and in the UK, and we've always stayed in touch with like-minded charities like themselves, and when we outreach to them, and Henry Schein, all these great companies, they helped us with so many resources, which without them we would not have been able to achieve the work that we did. Every time I used something, I don't know about you, Keval, but every time I used a forcep I needed, or that last piece of gauze I was telling you about, it's those people that come to mind.
Across